Hello, Mr. Marchand. I'm Matt. I'm going to be your student nurse today. So, what brings you to the clinic today?
Been shortness of breath, really, when I start walking, and don't even walk for very long, and I cough up some sputum once in a while.
So, basically, whenever you're walking, you just have a hard time breathing. What about when you're sitting down? Do you have any pain in your chest or anything?
Not so much when I'm sitting down.
Okay. Now, Mr. Marchand, can I ask you some questions about your past medical history?
Of course.
Okay. And what have you had in the past that might be contributing to this?
I've had two types of cancer before. I had cancer in my bladder and also in my gallbladder.
Now, how long ago was that?
Within the last 5 years, both of them were.
And you've been feeling better? You haven't had any?
Yeah, I've been feeling better since then, yeah.
Okay.
Until now.
Now, have you had any heart problems in the past?
About 13 years ago, I had a heart attack.
Okay. And no chest pains from that?
Not recently.
Is your blood pressure usually high or low?
I have low blood pressure usually. I'm on a medication for that too.
Okay. So you said that what brings it on is basically walking, and how 3 days it's been?
Yeah, 3 days.
Okay. So do you find that when you're talking, is it okay or?
It's fine if I'm sitting down talking, yeah.
Now, has your throat been burning because of the coughing?
Not so much burning, no, just the coughing up of the liquid and stuff.
And how much have you been taking any medication for the pains in your chest or no?
Not really, no, just my regular meds.
Okay. So it's getting worse, you say, and that's the reason why.
It is getting worse over the past 3 days.
Now, Mr. Marchand, I was going to ask you are you a smoker? Have you been regularly smoke?
I used to smoke about 20 years ago. I smoked for a good 30 years, but I haven't had a smoke in 20 years.
And has your family ever had any problems like this? Anybody else in the family?
There's a history of heart disease, but I'm not sure if that's related.
Okay. Now I'm just going to ask you another couple of general questions. Have you been voiding properly, bowel movements, all that stuff? Okay.
Yeah, everything's fine. Went today.
Okay. And how's your sleeping patterns?
Everything seems normal, really.
Okay. Is there anything else that's been bothering you today?
No, that's about it.
Okay, well, we're going to be taking some vitals and hopefully figure out what's wrong with you.
Perfect.
And when was the last time you visited the doctor? Did they notice anything?
I haven't been to the doctor in quite a while.
Okay.
Yeah.
So just that, basically what's...
The lungs, yeah. A little bit of loss of appetite, but...
Okay. And have you been feeling weak lately? Because you haven't been eating as much?
Weak when I'm walking around, yeah. I feel I get tired really fast and all my muscles are sore.
And how is it when you wake up? Do you feel dizzy or anything? You've been waking up?
Not so much, no.
Just okay.
Once I get moving around and stuff, then it really hits me.
Okay. Well, Mr. Marchand, that's most information I'm going to get out of that. And okay, Mr. Marchand, we're just going to be taking your vitals, listening to lung sounds, your heart sounds, and determine if anything severe is going to be coming about this. I'm just going to set this here. And can I just have your arm just for a sec? After finding out his respirations while taking his pulse, we noticed that his respirations were at a high amount at 22, and his pulse was a little bit over normal range. Alright, we would now be taking his O2 stats. We do not have anything to take that with. Also, we don't have anything to take the blood pressure with, so we would be taking his blood pressure right now. It was noted that his blood pressure was low at 90/65. The normal range is 120/80. His O2 stat was 90% at room air, which is very concerning. Normal should be 97/100. And now we can start listening to your lungs. Alright, now we're just going to be listening to Mr. Marchand's lungs. And while we do this, we're going to be forming a Z track. And Mr. Marchand will breathe in, breathe out, and we'll be hearing his lungs. Okay, just get you to breathe in. While listening to Mr. Marchand's lungs, there was crackling on expirations, and that is noted as wheezing, which is a concern. No other problems with that. How do you feel right now, Mr. Marchand?
I feel just a little dizzy, taking those deep breaths.
You are feeling dizzy? Okay.
Yeah, a little bit.
And Mr. Marchand is warm to touch. He does not feel cold at all. And if you could just sit back for me for a sec, and we'll just... No signs of stenosis in his fingers or lips. And if you could just pull that chair back, I'll check your feet. Mr. Marchand has no signs of edema in his feet. Nothing that would be a cause for concern. And yeah. Also, taking his pulse, there was no signs of dysrhythmia. Everything seemed fine, except for being a little on the high side. In the front, and kind of just get you to relax. Once more. Stop it. Alright, Mr. Marchand, we're going to be listening to your heart, and we want to determine if there's anything cause for concern because you did have a heart attack, and we want to make sure nothing is coming about. Okay, we're going to be listening to his aortic valve. At the second intercostal space. And obviously the second heart sound to be louder than the first. Then we would be coming over to the next side. And this is the pulmonic. Second intercostal space, also second louder than the first. Now we're going to be listening to Erb's point, which is the third intercostal. And obviously this would be equal. And tricuspid is fourth intercostal space. First is louder than the second. And then fifth intercostal space.
Just down a bit.
What?
Just down a bit.
A first heart sound would be louder. Right, Mr. Marchand, after listening to your heart, there's no signs for concern. Anything else? Mr. Marchand, we're going to be checking your abdomen for any bowel sounds, anything that might be abnormal. Just going to do a quick assessment of that. We're going to be listening to his 4 quadrants and checking to see if his bowels are hyperactive, hypoactive. And Mr. Marchand's bowels were hyperactive this morning. Did you have anything to eat today?
Had a good breakfast.
Okay. And you haven't, other than feeling dizzy, I guess, when...
No, nothing really.
No. Mr. Marchand, would it be okay? We're gonna just, I wanna see your gait, how you walk.
Sure.
Great.
I think a really tight chest here.
Okay. Now, did you felt short of breath even from walking like that?
Yeah, just that little bit.
Is there any burning in your throat or anything? Lungs? Do you feel like you're...
Yeah, my lungs, just my chest's really tight.
Okay.
Hard to breathe.
Well, your gait looks fine. I'm just a little concerned about that. With the way you're walking and how the shortness of breath comes about so quickly. And we're just going to be checking your pupils. We'll just do a little neuro test. And we would have our pen light when we go light and kind of just get you to... You don't have it. Okay. His pupils were equal, round, reactive, to light, accommodation, consensual. Everything checked out fine for that. Now, Mr. Marchand, can I get you to close your eyes for a sec? And I'm gonna test to see if you can understand the object that is in his hand. Can I just get you to open your hand, please?
That's a pen.
Yeah, good. Tested positive.